my name's Maureen Shafique and I'm a physician associate. I'm currently working in primary care and I've been practicing for 5 years now. Physician associates are healthcare professionals that are trained to the medical model. My role in primary care consists of doing morning and afternoon clinics and seeing patients typically with acute or same day appointments, but sometimes I do routine and follow-up appointments as well. In these appointments, I see patients, I'm able to take a history from them, do an appropriate examination and request any investigations that are needed and further manage them as well. In my day, I have time to complete admin and that involves interpreting blood results and actioning these results. It also involves completing any referrals from patients that I've seen and also acting upon any letters that come into my inbox as well. Some physician associates in primary care also complete home visits and care home rounds. Experienced physician associates are able to specialise further, so this might consist of women's health, minor surgery or leadership and coaching, and they can transfer these skills into their role in primary care. You'll also find physician associates working across hospitals as well. Ultimately, physician associates need supervision from a doctor, although they do work autonomously within the clinic room. They do need oversight from a GP. This is because physician associates do not currently prescribe and they're not able to request ionizing radiation. So they must have reviews and debriefs of their patients with a doctor in order to have these prescriptions signed and also to ensure patient safety as well. To gain entry into a physician associate program, students often have a bioscience first degree related, or they can be from a healthcare background, a registered healthcare background such as nursing or midwifery. Physician associate apprenticeship level 7 has also been introduced now, and there are a few integrated undergraduate physician associate studies at a master level as well that require A-level entry or an equivalent. The course itself is quite an intense 2 years, consisting anywhere between 46-48 weeks per year, and covers most of general medicine with some specialties as well. So 1,600 hours need to be completed on clinical placement, and of that 350 is general hospital placement as well. At the end of the 2 years, the students need to complete their National Physician Associate exam and OSCEs in order to then be a qualified physician associate. So I initially did biomedical science as my undergraduate degree because I thought I would enjoy research. Once I qualified, I started doing lab work and I realised that there was limited patient contact, and I didn't enjoy that, unfortunately. I wanted a lot more patient interaction, and that's when I came across the physician associate course, which was like a 2-year additional course and allowed me to then have all that patient interaction that I was looking for. Glad I pursued the physician associate role now because I find the role really rewarding, and it's really satisfying to see patients' journeys through their care within the NHS. If you are considering applying for the physician associate course, I would encourage you to shadow a physician associate either in hospital or in primary care. There are lots around in Bedford, Luton and Milton Keynes, and even spending a few hours with them will give you really good insight as to what the day-to-day role entails. I would also say do lots of research comparing physician associates to nursing and to also training to be a doctor as well, because there's a lot of differences between them, and it's good to know that this is the route that you want to pursue.